With all of these new exciting treatment options in CLL, a natural question arises is how much are these regimens going to cost? And sort of intuitively you would think that using one drug would be less expensive than using 2 or 3 drugs. But I think this is an area that we need to study, and so this is part of an effort that we've done in collaboration with AbbVie and Genentech to try to understand the cost of the currently available regimens in a comparative fashion. So using a fairly sophisticated economic analysis, there's a comparison made in this poster between Venetoclax Obinutuzumab as a 1-year time-limited therapy compared to a variety of other regimens that are available for frontline CLL treatment, ranging from chemoimmunotherapy to BTK inhibitor monotherapy, for example, as well as BTK inhibitor plus CD20 antibody. And really the bottom line conclusion of this study so far is that over about a 3-year time frame, there may actually be cost savings from using the 2-drug regimen of Venetoclax with Obinutuzumab over a 1-drug regimen of a BTK inhibitor given as monotherapy. And the reason being that with BTK inhibitor monotherapy, we need to give continuous drug. So over those 3 years, there's been 3 years of drug expense accounted for. With Venetoclax Obinutuzumab, it's designed as a 1-year time-limited therapy. And so far, I'd say the data look very promising in terms of the durability of response after stopping at 1 year. So during years 2 and 3, there's obviously a huge cost savings to not be giving ongoing therapy. So this also is a fairly early look. We need to look at longer-term data points to really understand the rates of retreatment with Venetoclax Obinutuzumab and how that might add up with additional costs. But we think this type of analysis will be increasingly important to help inform the guidance both for payers as well as for physicians trying to make the best choices for patients.